So in today's video, I want to go over the Medicare supplement plans and how they compare to the Medicare Advantage plans. And I want to be able to do this in a way that you can make an informed decision on what the best plan for you is. And there's two things that I want to talk about before I get started. Number one is if you have not seen my number one video, which is called Medicare Liars, which is up on the screen, has about 250,000 views. A lot of people have given me feedback telling them that this video really helped them make a decision on what Medicare supplement plan they should get. So it's on the screen here. If you type in Medicare Liars or Medicare 365, it should pop up on the screen. At least my profile will here, and then you can get to that pretty quickly. But here it is, Plan G, Medicare Liars. So that I wanted to show you. Also, if at some point during this video or after this video you want to make an appointment with me, my website link will be in the description box below, as well as that video link. And when you go to my website, you'll see there's an orange set an appointment up here with these people on the screen. You just click on that set an appointment. It will go to a calendar, and you can just choose your time and date on the calendar, make an appointment with me, and I can go over the plans in your zip code. If you don't know who I am, my name is Brian Monahan. I've been a licensed insurance agent for 15 years. I work with people that are going on to Medicare or people that are on Medicare already in 46 states. So there's certain states that I'm not licensed in. That would be Hawaii, Wisconsin, Minnesota, and Massachusetts. Other than that, you should be able to call me and I'll be able to help you out. I have clients in California, New York, Texas, Arizona, Florida, Michigan, South Carolina, North Carolina, Colorado, all over the country. So either set an appointment with me or give me a call, and I'd love to help you out. So let's start out with the chart that I like to show people to get into the different prices and the plans. Now on this chart, these are the top 3 Medicare supplement plans in the country. Now, some people want to know right away what companies they should choose. And I always tell them, instead of trying to get a company and look at a company, try and find out the plan that you want first. So for instance, if you want a Medicare supplement plan G, and you already know that, if you were to speak with me, I would go over all the different G plans in your area. So it's very easy. If you narrow it down to the plan that you want, it's easy to find the company. And if we go back to my website on here, I'll go to my ebook that you can get. There will also be a link down there. And I want to show you a chart on here. So I'm going to scroll through pretty quickly. Let me see here. How and when to sign up. So if I show you this chart, this is right here. Basically, this is what you're going to do if you're turning 65 or going on Medicare for the first time. Now, I always tell people sign up for Medicare Part A and B first. Some people are already on A if they're past 65, so you just sign up for B. But that's the very first thing that you want to do is sign up for Part A and B. And if you just want to look at the plans during this video, bear with me. I will get to that. I just want to get this over with first, and then I'll get into the plans. So after you choose to go on Medicare and sign up for Medicare Part A and B, you'll either choose a Medicare Advantage plan or a Medigap Medicare supplement plan, as you see on the screen. If you go to the left to Medicare Advantage on the blue side, that will be it. You will not have to do anything else as far as Medicare is concerned. You'll have your Medicare Advantage card and your Medicare Part A and B card, and you will be finished because it includes dental, vision, and hearing, a drug plan, and everything else. If you go to the right, the red side, and you choose a Medicare supplement plan, like a Plan G or a Plan N, you will then have to choose a separate drug plan and a separate vision, dental, and hearing if you want one. There's good and bad to both sides, but with the Medicare supplement plans on the red, you get to choose different companies and mix and match them together based off of your needs. With a Medicare Advantage plan, you choose one company plan, and that company will include all of their drug plan and their dental plan and that sort of thing. So let's head on over to this chart again. So let's say that you're looking for, you know that you want a Medicare supplement plan or Medigap plan, as some people call it. And you're saying to yourself, I don't know if I want a plan G or plan N or a high deductible G. I've heard about these three plans, possibly a plan F also. Well, let me jump into the numbers so that you can kind of gauge and make a decision on, or at least narrow it down to what plan you think is best for you. So on the left-hand side, you'll see here the Medicare card. This is what you're going to pay the government on average $164.90 for that Medicare A and B card. That has nothing to do with private insurance companies. That will go to the government just to be on Medicare. So that's the first thing that you're going to pay and the first thing that you're going to sign up for. A lot of people contact me and they say, I want to get on Medicare. I want to know about Plan G. And the first thing I'll ask them is, are you on Medicare already? Have you signed up? Some people don't even know how to sign up. So I actually help people sign up for their Medicare A and B card. It's fairly simple. You just call the Social Security office. But a lot of people do things out of order. So just keep in mind, you want to do that first. Sometimes they want to compare prices from their employer coverage with a plan G or N, and that makes sense because you want to compare all the prices before you make a decision whether or not you want to leave your job. But if you know you're going on Medicare, sign up for A and B first. So let's start with number one. Let's kind of get rid of the high deductible G plan for now. And we'll focus on plan G and then plan N. As you can see at the top of the screen, this is for a 65-year-old. A plan G is going to be about $140 a month. Now that is an average throughout the entire country. So what do you get with the plan G? So the first thing is you will pay nothing when you go to the hospital, inpatient. So if you think there's inpatient and outpatient, when it comes to inpatient, you will pay zero with the plan G and the plan N. That's the thing that they have that's similar. So as far as hospital coverage, you're going to get the best coverage in the country with both of these plans and pay nothing when you go to the hospital and stay inpatient. Plan G, when it comes to the doctor, the first thing that you'll have to meet is a $226 deductible. Now, that's for the year. That's not that much. Once you make that $226 deductible, once you pay that, everything else is going to cost you zero. So what does that include? That includes your doctors, your specialists, your CAT scans, your physical therapy, your ambulance, anything that is Part B is going to be taken care of. Now, if I scroll down here a little bit, you'll see you get 100 days of skilled nursing at $0 with this plan G. That is a long time to have skilled nursing, and you can get the best skilled nursing in the country. I've seen it. If you look at the next row, it says MOOP/YR. That stands for maximum out of pocket for the year. And how I came up with this cost, let me slide back down here. If you take this 140 and you multiply it by 12, because that's the premium you're going to pay each month, you will come up with, and I'm coming down here, you will come up with $1,680 for the year. That's the premium. That's going to go to the company no matter what. If you take $1,680, you add in that deductible, the maximum that you will pay for doctor hospital visits will be $1,906 for the year. That includes premium, deductibles, copays, everything. Let me scroll back up. So why is Plan G the most popular plan out there? Because I can tell you right off the bat the maximum that you're gonna pay per year for what you do. This includes if you had cancer and you had to go get chemotherapy a few times a week, or if you had a heart attack and went into the hospital, then had to have skilled nursing. If you had a stroke and you went into the hospital, had multiple specialists and doctors visits, you went into skilled nursing for 80 days or 100 days, then you had to go to multiple specialists after that, you would still, that maximum would be $1,906. Now, the only thing that all of these plans do not cover and I'll scroll down, is your drug plan, a dental, vision, and hearing plan, and all those extras that you might hear on television or wherever, such as a gym membership or a flex card for free stuff at CVS or Walgreens or wherever you go. Those are the things that are not covered. With these three plans, you will get separate plans for that. Now, let's take the drug plan first. I'm going to explain this once because this goes along with the G, the N, and the high deductible G. So as far as a drug plan, the least expensive, let's say you take a cholesterol drug like simvastatin, for instance, and maybe you take a blood pressure drug like lisinopril or benazepril. These are generic drugs. Most likely, you can get a drug plan for $5 a month, and these drugs might cost you $0 or $1 or $2 as a copay. Now, if you take really expensive drugs, the drug plans could go up in cost. I really haven't seen anyone pay more than $35 a month for their drug plan. That's an extreme case, and that's with brand name drugs and a lot of copays and so forth. They might pay $35 for their premium and then have bigger copays. But if you're only taking a few generics, or even if you're taking 5 or 6 generics at 65 years old or whatever you are, you're pretty much going to pay $5, $10, $15 at the most. So you would add that to your premium each month. Dental, vision, and hearing, I put down it. No, that means it does not cover it with the GN or high deductible G. But for $40 a month, something like that, you can get dental, vision, and hearing coverage. And you can get it even cheaper if you just want dental coverage. Maybe you'll pay $10, possibly $20 a month for that just dental coverage. Let's scroll back. So Plan G, that is what the majority of people getting on a Medicare supplement plan, that's what they get. Why is this? It's because it's very clean. They know what they're going to pay. There's no red tape. Nobody's ever unhappy with the coverage. The only thing is, it's the most expensive plan out of these three plans. I've told many people, these are the only three plans that I give to people now. There's 10 different Medicare supplement plans. I only talk about 3. I do not discuss the other ones. I don't find them necessary and they're not cost effective. So I just leave them out. The second one would be the Plan N. Now the Plan N, there's some controversy around this. And the reason being is it has an excess charge. I'll just get this out of the way real quick. This really throws people off because if a doctor does not accept Medicare's allotted amount for their payment, they can charge up to 15% on top of what that amount that Medicare would give them. Now, here's the thing. Less than 3% of the doctors in the country charge an excess charge, and it's not for hospitals and so forth. It's not for inpatient. It's only for Part B, which is outpatient. And another thing is, most of the doctors, I think it's 45%, that would charge an excess charge are in the mental health arena. They're not regular doctors. But it still throws people off with the Plan N. I myself, I've put a lot of people on Plan N. There's certain states that do not have an excess charge. If you call my office or make an appointment, we can go over which ones, or if you live in a state like that. But people save a lot of money with the Plan N, and I'll go into this. Now, because a lot of people that watch YouTube channels, they watch different channels than mine that discuss the Plan N and so forth. And sometimes they'll say, hey, I was watching this particular person and they said this about this. I do know some people in the industry that I respect a lot that use the Plan N for most of their clients. So that's a good sign. So let's get into Plan N. Plan N, on average, the premium would be $106. Just last week, signed up a couple people with Plan N, and the premium was $84 a month or something like that. It was in the 80s range. That is extremely cheap for the top coverage in the country. So what do you get with the Plan N? You have 0 copays and deductibles when you go to inpatient, the hospital, just like Plan G. What you do pay is that same thing as Plan G, $226 for the deductible for doctors or specialists, the Part B. After you're done that $226, you will pay up to $20 each time you go to the doctor. Now notice I said up to $20. Your doctor can choose not to charge you at all. They can charge you $10, they can charge you $15, $13, whatever they want. I've been told on average it's $12 to $13 what a doctor's visit charges you. But for this, let's just say you went to the doctor once, and I'll get rid of this. So let's say one time. So you pay your $226, then say you pay $20. Well, let's go over this. I'll scroll down again. Whoops. So plan N. You pay your $106 times 12. That will be $1,272 for the year for the premium. Then if you pay that deductible, which most people do if they go to the doctors, that would be $226 for the year. Your out-of-pocket cost would now be $1,498. Now let's say you went to the doctors 10 times at $20. You would take that $1,498. 10 times at $20 would be $200, and the most that you would pay would be $1,698. So as you can see, it can still be, if you go to the doctors 10 times for the year, still be less than the Plan G. Another thing that it has is a $50 emergency room fee, but if you're admitted into the hospital, they waive that fee. So if you go to the doctors less than 10 times a year, or even if you go 10 times a year, if you go 10 times a year, what did I say, 1,698, then you're still going to be charged less than the Plan G. And the drug plan, vision, dental, and hearing will be the same. It will be separate, and I went over that earlier. Now, I'm telling you what happens is when I go over Plan G and go over Plan N, I'm not pushy with people. I really give people the facts. This is what it is. These are the companies in your area. These are the prices. I don't put anything on top of the prices or anything. I can't change anything. It's against the law, so none of us can. But for some reason, most people get the Plan G. They do not want any red tape, even if it's less than 3% of an excess charge that doctors would charge, plus half of them are mental health, like psychiatrists and so forth. They still don't want to mess with it. But a lot of people, when I talk to them, they say, you know what? I've heard good things about the Plan N, and that's what I want to try first and get on that plan. So it's becoming more and more popular. I've heard other brokers talk about that 50% of their clients get on it. Some 80% of their clients get on Plan N. Mine is about 50-50 this year. In years past, Plan G, that's the majority of my clients, but now it's turning into 50-50. I think the Plan N will continue to grow. So let's move on to the high deductible G plan. Now keep in mind with all these plans, $164.90 you will pay for that Medicare A and B, and then this premium you will pay for each separately for these plans. So the Medigap high deductible G. Now I have about 10% of my clients, I'm making up these percentages too. I don't know exactly, but about 10% of my clients get on the high deductible G plan. And there's a couple reasons why I really like this plan. Number one, if you're looking at a Medicare Advantage plan because it's inexpensive, and let's say you're really healthy and you do not want to put out the money for a G plan or an N plan, you're looking at a Medicare Advantage or a high deductible G plan. You can get on a high deductible G plan for $40 a month, and you won't get all these perks like you do for a Medicare Advantage plan, but you will be able to go to 99% of the hospitals and doctors in this country. So if you have a serious illness and you're on this high deductible G plan, you're going to thank your lucky stars that you're on this plan as opposed to some of these Medicare Advantage plans. Because the only question you have to ask when you're going to a hospital or doctor is, do you accept Medicare? And if they do, they accept any of these plans. By law, they have to. Plan G, N, and high deductible G. And that goes for any company that you're on with these plans. So like I said, I don't discuss companies so much because once you pick a plan, There'll probably be 30 different companies to choose from, at least 10 or 15 in your zip code, unless you're from New York, then you'll have a very small amount of companies. But you'll be able to choose a company based off of you've heard of them, the price, and those sort of things. But the high deductible G, the way that it works, on average, if you look at the state price, on average, the high deductible G is $40 a month, and that's pretty much standard throughout. I've seen, what's the lowest I've seen? $28 a month, I think. The lowest I've seen. I can't remember what state. But pay that $40 and you pay 20% of the total cost up until $2,700. Now, some people look at that and say $2,700. I mean, if you really think about it, you're only paying $1,000 more a month than the regular Plan G if the worst happens. Now, what would have to happen for the worst to happen? You would have to go in the hospital multiple times, or you would have to have cancer or something really major happen to you. And then if you did, $2,700 probably wouldn't seem that much, because if you had the Plan G, it wouldn't cost you anything, and that's $2,000 basically. So it's only about $1,000 more a month, but you can save in premiums, and a lot of people like that. I've mentioned this on some of my other videos. There is one company, it's not in every state, but when I talk to people, they always say, hey, on the video, you mentioned this one company that after 2 years, you can go from a high deductible G to a G or an N without underwriting, no matter how sick you were. And this is true. If you wanted to go from a high deductible G and you got on this company, after 2 years, you can go to a regular G, no questions asked. And if you're healthy after a year or two and you want to go to a regular G or N, you just go with another company and go through underwriting. Underwriting is very simple. That word is like a cancer word, but it's not that bad. Basically, they have 12 questions. Have you had in the last 2 years? It could be in the last 5 years. Have you had cancer, stroke, heart attack? These type of major things happen to you. If you're on a couple blood pressure medications, or if you had, a knee injury 3 years ago and you had to get your hip replaced, 5 years ago, that's not going to keep you out of these companies. So don't let that word underwriting get you wound up and upset. If I jump into Medicare Advantage as opposed to the Medigap plans, and I'll just do this real quick and I'll end this video, and then on the screen I'll show you the video, Medicare Liars. You can click on that if you want to watch that. People have told me it helped them tremendously. And once again, I'll show you, going to my website, how to make an appointment. But the Medicare Advantage, a lot of these plans are zero premium plans. You have got to speak to a broker if you want to look at these plans. I did put someone on a Medicare Advantage plan last week. It's not every week that I put someone on an Advantage plan. I'm not a huge Medicare Advantage plan guy. Every single week I put people on Medicare supplement plans, without fail, multiple people. But Medicare Advantage, just last week I had somebody. And here, since it's fresh in my head, what happens is it's zero premium plans, they're PPO plans or HMO. There's a couple of pitfalls with these plans. Number one, if you call the doctors and you ask them, do you take this plan? You have to be specific with the plan. You can't just say, do you take Humana? Do you take Aetna? Do you take AARP? They will say yes, or they will say no, and they won't have a clue. You have to say, do you take Humana H2500, that plan, the PPO plan? And they most likely won't even know what you're talking about. So you should talk to a broker. Do not talk to some of these doctors, or not doctors, but you'll talk to some doctors' offices, and unfortunately, a lot of these people do not know. You can even go on their website and it will say, we take these companies. I've called them personally and I've gone back and forth and say, hey, look, this is what, and they've said, oh, we didn't realize there was different plans. I don't know how, after you've been in business for 10 or 15 years, you don't realize, but that's the way that it is. Another thing is, these plans can deny some of this coverage, and you can go back and forth. I got a phone call last week from somebody, and she's going to know who she is if she sees this. She was a nurse manager or something, and she said, listen, you talked about this one company. I just want to let you know, my clients, and this is Medicare Advantage, not the Plan G or N or high deductible G. She said they are denying coverage like crazy. We tell everyone, do not get this Medicare Advantage plan. I thanked her for calling me. She was super nice. She didn't have to do that, but she gave me some insight. So this is great when I get calls from different people and they don't want to go over things. They want to actually talk to me about something. This could be nurses and so forth. But the big deal is for Medicare Advantage plans, you have to look at the maximum out of pocket per year. If you look at over here on the chart, some of them are $3,000, $5,000, $7,000, $10,000, and you don't want to be paying $10,000 for the year for the maximum out of pocket. And some people would say, oh, you're never going to meet that. Well, be careful, because if you have, like I said, chemotherapy, one of these things where you're in the doctor's office twice a week, you could meet these maximum out of pockets. And another thing is, just because it's a PPO and they say it's accepted anywhere, the doctor they don't have to accept you. So you might want to go to a specific doctor and they won't accept it. Real quick, once again, if you go to, let's see here, if you go to my website, there's two things. You can set an appointment up top here just by clicking the button, and you'll go to this calendar. You just click on the date and the time and hit next, and you'll set yourself up. You'll be able to talk to me, and you will talk to me. It won't be somebody else. Then on top of that, if you go to, just real quick on the website and you see ebook here, and you click on this ebook, it will take you to my book that I wrote myself. It's on here. You don't, as you can see, you don't have to put your name in or anything. You can just go directly to chapters. So you click on the chapter, it goes directly to it. You can read about it. There's usually a video. Let me see here if this chapter, of course, is the one I choose that doesn't have a video. But if you scroll down, oh, here you go. Most of the chapters have a video on it. So you click it, it's a YouTube video, just plays right on here. And it's the explanation to the chapter. So thanks so much for watching the video. Let me just put my name and phone number on the screen, and also the Medicare Liars video. You can click on that. A lot of people have told me it's helped them a lot. Thanks for watching the video. I'll see you at the next one.